Welcome. I'm so happy that you are able to join us for today's webinar on the impact of COVID-19 on the mental health of children and how to protect children's privacy online. Get ready to be amazed. We have a great webinar planned for you today, led by four dynamic speakers who are subject matter experts in their respective field. My name is Linda Williams. I am a community outreach and training manager with Consumer Action, or CA, and I'm coming to you live from sunny Fontana, California. Before we get into the featured presentation, I need to go over a few housekeeping tips, introduce you to CA, and review the agenda. But first, I need to thank our sponsor. Today's webinar is part of a series of webinars that Consumer Action is hosting in response to the COVID-19 crisis. Our work on the COVID-19 project is made possible by a grant from Wells Fargo. And on behalf of the entire staff of Consumer Action, I would like to thank Wells Fargo for their support and their continued support. Now, as the announcer stated when you joined the webinar, you are in listen only mode. However, if you have questions, and we hope you have tons, you can use the question function on the right of your screen to type in your questions. If you're on Twitter, you can use that platform to ask your questions. Our organization handle is at Consumer Action, or you can use our go-to hashtag, which is CA Webinars. My colleague, Nelson Santiago, will capture all of your questions and he will present your questions to our speakers during the question and answer segment. Now, the webinar is being recorded and it will be available to you tomorrow afternoon via a Dropbox. At the end of the training, you will receive a survey about today's webinar. Please, please, please complete the survey before signing off. We use those surveys to help us continue doing the work that we're doing. Now, let me introduce you quickly to Consumer Action. What do we do? As it says on the screen under Welcome to Consumer Action, through education and advocacy, Consumer Action fights for strong consumer rights and policies that promote fairness and financial prosperity for underrepresented consumers nationwide. How do we accomplish this? We advance consumer rights by referring complaints through our national hotline, by publishing educational materials in multiple languages, through our monthly newsletter, The Insider, our quarterly publication, CA News, and by advocating for consumers in the media and before lawmakers. And another important function of consumer action is outreach. Nelson Santiago and I are constantly reaching out to community-based organizations across the U.S. to engage them, to show them how they can use our multilingual educational materials to help their clients reach their financial goals, and by providing trainings like this webinar. Since so many agencies joining us today are kind of new to consumer action, I thought I would just take a couple of seconds to show you how to download our free education materials from our website. Let's say you are working with a group that's looking to make ends meet by driving for Uber. And since so many people are unemployed, everyone is looking for a second job, and you're interested in some type of training module for your group. Go to our website. The address is on all the documents you receive from us. It's also there at the bottom of the screen, on the screen. When you're on our website, under quick menu, select the training module. Scroll down to insurance and the sharing economy and click, and voila, you will be led to all of the publications that we've created that's related to protecting yourself from financial risk in the gig economy. For an example, you will find a backgrounder's guide with question and answer, a lesson plan, a PowerPoint, and check this out. Our PowerPoint slides, you will find talking points in the notes section. Now, if you're interested in our COVID-19 education project, just click on the words in the green bar and you will land on our COVID-19 page. But on the page, click on the words resource guide to find valuable resources for consumers impacted by COVID-19. And these resources are in different languages. Click on the words fact sheet and you will find fact sheets like the one pictured to the right, making a job career transition, or you will find one on fair housing in the COVID-19 era. Click on the words webinar and you will find recordings of some of our past great webinars, such as fair housing in the COVID-19 era, scams and medical fraud, estate planning, and one that has broken all records at CA, the impact of COVID-19 on domestic violence and financial abuse. Now, we are a 501c3 organization, and like all 501c3 organizations, we're supported by membership, donations, and grants. So at the end, I'll come back and I'll tell you how you can donate to Consumer Action. So let's take a quick look at the agenda. At the CA, we believe in making learning fun. So we open up every training by testing your knowledge on the topic of the training with one of our most popular games, How Much Do You Know? So we have 5 quick poll questions for you today that you answer either true or false. Following the game, Dr. Jamie Aten will open up the presentation, open up with his presentation on COVID-19's impact on the mental health of children. He will be followed by a joint presentation on protecting children's privacy online, led by Ariel Fox Johnson and Mr. Bill Fitzgerald. And our closer is Dr. A. Paul Kurjan, MD, board certified adult and child psychiatrist. The question and answer session will follow. And once that's completed, I will come back. I will tell you how you can donate and I will wrap things up. So let's get started with our first poll question. Steve Harvey, launch the first poll question, please. 3 in 10 parents say their child has experienced emotional or mental health issues due to social distancing and school closures. Is that true or is that false? 3 in 10 parents? Is that true or is that false? Okay, let's wrap it up. Let's wrap it up. Okay, let's see the results. Okay, so 78% is saying it's true, 22% say it's false. Well, 22%, you are wrong. That is absolutely true. In fact, the article that we put in the link to the invite had the survey, the study there. Let's launch the next poll question, please. The Children's Online Privacy Protection Act, ACOPA, details what commercial website and online services must do to protect the privacy and safety of children when online. Is that true or is that false? Okay, let's see the results. Wow, 90% of you believe that's true and only 10% think it's false? Well, 90%, you're correct. That is true. Please launch the next poll question. Some challenges children face during COVID-19 are challenges to routine, breaks in continuity of learning, and loss of security. Loss of security? Is that true or is that false? Okay, let's see the results. Wow, 99% think it's true and only 1% think it's false. 1%, I'm sorry, you're wrong. It is true. Let's launch the next question. Schools can share a child's personal information with third parties without the parent's consent. Come on now. Schools can share a child's personal information with third parties without their parents' consent? Is that true or is that false? Okay, let's see the results. 16% says it's true, 84% says it's false. And luckily, we have 2 privacy experts on. You're going to hear more up from them about this, but it is true. It is true. Let's launch the last poll question. The Family Educational Rights and Privacy Act give parents the right to request that certain inaccurate or misleading information in a student records be corrected. Is that true or false? Okay, let's see those results. Didn't you sense a pattern? 85% is saying it's true, 15% is saying it's false. That is true. Thank you for playing along with us. I hope you enjoyed the game. We're going to put some of these on our website. You will be able to download the game. Uh, let's move on and let me introduce you to our guest speakers. I have really enjoyed some of the articles created by our first guest speaker, Dr. Jamie Aten. PhD. He is the founder and executive director of the Humanitarian Disaster Institute and the Blanchard Chair of Humanitarian and Disaster Leadership at Wheaton College. He is the author of A Walking Disaster, What Katrina and Cancer Taught Me About Faith and Resilience. He is the author of the Spiritual First Aid Manual, and he curates resources at the Spiritual First Aid Hub. He is also the author of several articles published in Psychology Today, including how to talk to your kids about COVID-19 and COVID-19's mental health effect on children and adolescents. In 2016, he received the FEMA Community Preparedness Championship Award at the White House, and we are honored to have him with us today. Now, you may know your kids and grandkids, but at Common Sense, they know media and tech. Common Sense Media rates movies, TV shows, books, and much more so parents and grandparents can feel good about the choices they make for their children. Our next speaker is Ariel Fox Johnson. She is the Senior Counsel for Policy and Privacy at Common Sense Media, where she advocates for smart practices, policies, and rules to help all kids thrive in today's world. Her work focus at Common Sense is on enhancing family privacy rights, strengthening student educational policy, and promoting robust consumer protection in the online world. She frequently advises policymakers, industries, and tech experts and has helped develop laws on student privacy, consumer privacy, and the Internet of all things. She is a graduate of Harvard College and Harvard Law School, and we are thrilled to have her with us today. Now, I'm sure you've heard of Consumer Reports. After all, it is the consumer organization dedicated to unbiased product testing, investigative journalism, consumer oriented research, public education, and consumer advocacy. Our next guest speaker is Mr. Bill Fitzgerald. He is a privacy researcher for Consumer Reports. He is also an educator, a technologist, and an advocate for student centered learning. He has also been known to read far too many privacy policies, but we won't hold that against him, run apps through an intercepting proxy, and do information and ad tech research. He is also an experienced trainer, presenter, project manager, and works with different stakeholders to help explain and manage their expectation. He is the author of numerous articles, including Student Tracking and College Board. Fall 2020 Open Challenge for Data and Privacy Prototyping, and you can follow him on Twitter. Now, over the last 8 to 9 months since this pandemic hit us, I'm certain you've heard on your local news, on CNN or MSNBC about the work that our medical professions are doing on the front lines, trying to, working through this COVID pandemic to help individuals. Well, you don't have to wait for Anderson Cooper to come on the night. Our closer is Dr. A. Paul Kurjan, who is on the front line in parts of Los Angeles County where the COVID infection is soaring. He's an MD, board certified adult and child psychiatrist. He graduated from the University of California at San Diego, majored in psychology, double minored in biology and chemistry. He obtained his MD at Drexel University College of Medicine in Philadelphia and completed his adult psychiatric residency training at the University of California, Los Angeles. He completed child psychiatry fellowship at Cedar Sinai in 2010. He is the winner of the Stephen M. Thompson Loan Repayment Grant for serving underserved communities. He completed his physician leadership program at Memorial Hospital in Long Beach, and he is the director of the Collaborative Care Outpatient Psychiatric Model for all Memorial Care Output Psychiatric Services. Need I say more? He is currently working at various outpatient child mental health facilities, such as El Centro, the Children's Clinic, Bickerstaff Family Center in Para Los Niños. He's taking child psych calls at White Memorial Hospital, Milliner Children's Hospital in Long Beach, and Huntington Memorial Hospital in Pasadena. He is the director of the psychiatry. He's a director of psychiatry at the Wellness Center in Los Angeles, and he is extremely dedicated to the community that he serves. He is fluent in Spanish and Armenian, and we are more than honored to have him with us today. Now that I've introduced our guest speakers, let me move forward and turn the presentation over to Dr. Aten. Just give me 1 second to turn it over to him. Take it away, Dr. Jamie.
Well, thank you so much for having me, and really looking forward to spending some time and learning from others today. But in my talk, I'm going to start by how we can support children through COVID-19. And what I really want to do here is just really provide some practical resources and practical helping approaches that I hope will be useful to you as you care for those that your organizations are responding to. I want to start by sharing with you our COVID-19 mental health handbook, and you can find it at spiritualfirstaidhub.com. And this is a free resource that our team at the Humanitarian Disaster Institute, along with myself, developed to be able to help others be able to provide care and understanding of what's going on with our mental health during this time of pandemic. And this is a free 195-page resource book. And in it, there's a number of great articles that we have experts from around the country and even around the globe that have contributed to it. And so here we look at a number of the most recent research studies that have come out on COVID-19 mental health, especially for children. One particular study that I want to highlight is one that had found that even before the pandemic had struck, that many children and adolescents in particular reported incredibly high levels of isolation and feeling lonely already. That some studies have found that among adolescents in particular, that children have oftentimes reported feeling more withdrawn from others, despite being more connected in some ways than ever before because of social media. And so that really kind of moves us into, what's happening with our children. How's this pandemic starting to impact them, and what's it like for them for those that are having to kind of ride this as a roller coaster a bit, right? That if some, their schools are meeting in person, others have already gone full virtual, some it's a mix, or if you're finding you're working with kids like my own children in their school system, that it's been all of the above, that they started closed, then they opened, then they were half online, half in person, and then just recently to this week, all back completely virtual again. And we're starting to hear from a lot of parents that we're working with and organizations about the toll that kind of back and forth roller coaster is starting to have on children. We know that times of uncertainty and of extreme stress can be really challenging for children, and COVID-19 in particular. So how do we actually go about talking to our kids about COVID-19? Well, I kind of want to back up for just a moment and suggest that this really starts with taking care of ourselves in many ways. That one of the things that we've seen from working in disasters and traumas and public health crises around the globe over the last 15 years has been that how we're impacted by our current circumstances is going to have a direct impact and our ability to support and care for children that we may be working with, or maybe it's our own children in our homes, for example. So I want to really encourage you to prepare yourself before reaching out to care for children in your home or in your community. That one of the things that I've often seen is that the children will feed off the type of energy that we bring to the setting in which we work or in our home setting. So if we're feeling highly anxious, or we're feeling extremely depressed, or just really overwhelmed, our children in many ways are kind of like a sponge, and they're going to pick up on that and absorb that stress from us, and it's going to compound the stress that they're likely already experiencing. So if you really want to make a positive difference in the lives of children, start with how you're modeling and coping with stress around this pandemic in your own life. We also want to find a way of being both hopeful, yet at the same time realistic with children. That we want to make sure that we're delivering age-appropriate facts to them and talking in language that they're going to understand. So one of the things I often recommend to parents who are working with children or individuals working in organizations caring for children is to start by asking the child, what do they know about the pandemic? What have they heard? How do they understand things? And the reason why I ask that is it helps to give you a bit of a baseline to know how to best meet that child where they are in their own understanding. And it's also going to help you understand how to best tailor your response in talking about COVID-19 in ways that the child is going to understand. So as you ask them these questions, don't just listen to their answers, but listen to how they say it. You know, what is the body language that you might pick up on? Are you noticing that they seem extra anxious, or does it seem like they're not really all that concerned? Also, listen for the words and the phrasing and the language that they're using, because that's going to help cue you in to know how to tailor your types of responses so that the kids can actually interpret what you're saying accurately. We also want to make sure that we're providing regular reassurances that now this can be hard for those of us that are taking care of children, that we want to be hopeful, but sometimes our hopefulness turns into, instead of realistic information, can turn into false information. So we want to find a way to balance that, you know, there are precautions we need to take and to be truthful with the kids of the dangers about COVID-19, but at the same time, reassuring them that, you know, their parents and the adults in their life, the schools, for example, your organization, are doing what you can do to the best of your ability and to the best of your resources to keep them safe. So you want to let them know that they are in a place where others care about them and are taking steps to help them. Something else that I would highly recommend when talking to our kids about COVID-19 is trying to make sure that we're monitoring and limiting media exposure. You know, I'll give a different example outside of COVID-19, for example. A number of years ago, after 9/11 had occurred, I remember getting a call from a couple of parents that brought their child in because they were concerned about how 9/11 had maybe been impacting this child. And this child at the time was only about 3 or 4 years of age. And so they really thought that the child had no idea about what was going on after the terrorist attacks. But the reason why they had called in concern and brought their child to therapy to see me was because the child had started playing with some Lego blocks and then taking a toy airplane and running it through the blocks, mimicking the images that he had been witnessing on the TV screen. And so this is a case that I see happen on a regular basis, not that particular 9/11 event per se, but where parents think that the kids aren't really watching the media or the news that they have on in the background, or that the kids aren't really hearing them talk about them recounting or rehashing the news from the day. If you're working with children, know that they're likely aware of more than what you think they're aware of. So pay attention to how you're engaging media or talking about it around children, but also monitor their own intake. That we want us and our children to be informed, but in ways that are healthy. So one of the things that we've seen with a lot of teenagers is them getting involved in doomsday scrolling. And maybe you've heard this term before, which is, and maybe you've even done it during the pandemic, where you hop online and you suddenly are checking out Facebook or Instagram, and next thing you know, you're 20 stories in, and you've been going from one tragic story to one anxiety provoking story after the next. Well, our kids are no different, that they often will also engage in this sort of behavior, or that they've maybe been watching YouTube videos, and that the algorithm is now starting to suggest other videos that maybe start to get more intense and may not necessarily be appropriate for your children that you're working with or in your home. So make sure that you're keeping a close eye on social media. Another reason why you want to pay close attention to technology in your home is really kind of twofold. One is that sometimes our children are continue to re-engage with this information in a way that it actually starts to become traumatic for them, that they're self-traumatizing to some extent, that they're really saturating their experience with news and social media that's just not helpful. So how do we then go about actually identifying when COVID-19 might be taking a toll on our children, whether that's specifically trauma or more broadly struggling with anxiety or other mental health problems? Well, one of the things that we should be looking for is to see, are the children acting out? I remember the way I first got involved in doing disaster and trauma type of care was that I had moved to South Mississippi just 6 days before Hurricane Katrina hit. And so I had worked for 5 years in my community before moving to Chicago to help address the mental health issues caused by that particular event. And I'll never forget that there's this one community organization where we'd gotten together, this large meeting, and there were probably about 20 or so different groups there. And as we were talking about some of the challenges that we were noting, many of the community organizations present started quickly talking about how they were noticing this huge spike in bipolar disorder, is what they were referring to it as in that particular meeting. And everybody started talking about all this bipolar issues that they were witnessing. So I actually asked each of the attendees to pause for a moment and let's not use that label for a few minutes and instead describe for me in concrete ways what you're actually seeing. So we're not trying to diagnose here. Let's hold on the labels, and in this meeting, just share concretely what you're actually seeing. And so as each person went back through, I started writing on the chalkboard, labeling out the different symptoms that they were noting. And at the end of that conversation, we realized that what they were actually seeing in that particular instance was trauma, not necessarily bipolar disorder across the board. So the reason why I tell that story is that I've also been in situations talking with different schools and different nonprofits in the Chicago area since COVID-19, and I've noticed similar types of conversations where instead of them talking about bipolar disorder, like what was talked about in that meeting after Katrina, instead talking about how the kids are just so angry all of the time, or that the kids are acting out. I don't know what's going on, but it's like somebody just turned a switch and it's like everybody's acting out. And I noticed that when that type of conversation starts happening, they start to want to blame the child, or sometimes blame maybe the families or community. And granted, yes, that can be the case. But right now, if you're seeing a child acting out, it's probably more of a red flag that they're struggling emotionally with what's going on because of COVID-19 and don't necessarily have the tools or resources to be able to share that or explain what they're going through. So we want to make sure that when we're working with children, that we're looking for those acting out signs. Another kind of key red flag to be on the lookout for right now is also physical complaints or symptoms. So for many children, they'll internalize the stress that they're experiencing from COVID-19, and rather than them being able to actually identify the emotion that's causing it, they'll probably more likely be able to access and readily communicate to you a physical complaint, such as maybe my stomach is hurting, or I'm feeling nervous, or I feel like I have bees in my chest. These are all types of things that I've heard children say since COVID-19, or those who are working with children say that kids are using to actually describe more symptoms related to anxiety, for instance. Another kind of physical issue that we might be on the lookout is to see major shifts in their behavior and personality. So what I mean by that is if a child is normally pretty low key and laid back, but now suddenly is talking in very pressured speech or seems to be overactive, then that's maybe a sign that they're struggling a bit, and vice versa. So we're really looking for any kind of shifts in the normal ways that the child tends to interact or behave with others. I also want to point you to another resource that we developed on helping children cope with traumatic events. And so for some children, COVID-19 may indeed have been a traumatic event, but for others, very much less so. And it might be much more of just a general stressor for them. But still want to recommend this particular free resource that you can find at wheaton.edu/HDI. And you can download this manual there for free, and it can be applied across a wide range of stressors. And a few of the tips that I'd like to highlight from that particular resource that I hope will be useful to you in caring for children is that we want to make sure that we also talk about safety steps with our children. So they are spending more time online, likely, and I thought this would be hard to say, but probably more than they've ever spent online because of COVID-19. And so we want to pay attention to monitoring the type of websites that they're visiting, and also that they're making sure that they're only interacting with individuals that they know for their own safety. One of the other things that we can do and that we talk about here in this particular free resource is that oftentimes our children are going to need to have us go above and beyond in recognizing positive behavior. So as I mentioned, quite often in difficult times, adults are quick to point out the negative or the bad or the troubling. So this is a really unique time for us, and a time in which we need to make sure that we're going that extra mile to praise children for the things that they're doing well, to point out things that they're doing well, and to point out who they are as being something that they're doing well. So looking for those kind of character strengths, or looking for ways that they're coping in positive ways, those are all things that we can start to point out in the moment. They can go a long way to providing assurance for children. Something else that we should try to do is to help our children to really maintain some consistency in their life or in our organization. So for instance, if prior to COVID-19, there were certain types of routines that you followed when working with children, as best as you can, try to find a way, even if it's virtually now, to try to keep those routines in check. That really helps children to be able to find ways to feel more normal. Similarly, you can encourage children or their parents to also try to maintain some similar routines that they had prior to COVID-19, even if they are quarantining or staying at home or sheltering in place. So trying to find that kind of sense of normalcy as best as we can, even during such an abnormal time. And then something else that we can do for children is to be able to help them with the coping that I was talking about in that last slide, is to help provide them with some basic coping tools. And so I've found sometimes children, will be kind of hesitant to try some things, especially wondering, will the other kids notice, maybe while I'm online, or even if I'm back in school in person, that I don't want anybody else to know that I'm doing something because I feel nervous. And so look for ways that you can talk to the children about and ask them about what has worked for you in the past. Can you think of a time where you've been really nervous, or maybe you've really struggled, and what was it that helped you then? And then to help them draw those lessons out and applying it to the now. And then one of the most easiest coping strategies that you can teach children is just how to do some basic deep breathing. And one of the things that I've done with clients in the past who are children and that have struggled with anxiety or other struggles similar to that, is to, as I'm actually talking to them and they start to maybe get concerned about how maybe one of their friends will see it. So one of the things that I try to do is actually practice and be mindful of my own breathing as I'm talking to that child, to be able to let them know that I've been doing deep breathing most of the time that we've been talking, and you haven't even noticed. So your friends aren't going to notice either. So here's some ways of, I want you just to breathe in and hold it, pay attention to how that breath feels, even pay attention to the coolness on the tip of your nose from taking that breath, that you can do all of these things and that others don't have to be aware of it. So provide them with some of those just real basic coping tools can go a long way. Something else that I already alluded to briefly, but is talking about youth and internet safety during COVID-19. So here's a tip sheet that we developed along with the Global Human Trafficking Force and also the Salvation Army. And here, one of the things that we've seen is that oftentimes during times that kids are isolated, that we know that they're more at risk for others to take advantage of them. So again, we want to make sure that we're monitoring the types of internet usage that they're engaging in and the people that they're talking to online. Something else that can be really helpful is to make sure that we try to create healthy habits for the children that our organizations are working with, whether that's in the school or in their homes or in your organization. And one of the things that I've found particularly helpful, not only in recommending this for other families or organizations to use, but one that I personally use with my own family, is that we've instituted weekly family meetings. So in the same way that you have a regular staff meeting or check-in time, we actually try to do that now in our own household. And I'm sure that my teenagers and tweens are probably just as excited about having to go to a family meeting as most of you are of having to go to a committee meeting. But we found this to be a really helpful tool, and it's something that we've just built in now to our family routine. So we actually do this every Sunday afternoon, where the first few times that we did it, it was hard to get everybody to sit still. The first few times that we did it, there was protest of why do we have to do this again? To now, it's been surprising to actually see where our children are helping to shape the meeting time and speaking in and coming now with agenda items even to be ready to talk about as a family. So just having that has been really useful because everyone, including the parents and the children know that this time is going to be available, that during these busy times of COVID-19, that sometimes we still miss each other and don't always connect with each other in useful ways because we're so busy, even though we're at home together all the time. And this is just that moment that makes us sit down, take time to talk about serious things, check in to see how everybody's doing, gives us a chance to find out what are our kids actually watching or listening to when they're in their rooms supposedly working on homework, right? That it's just a nice way to check in and have kind of a way to check a pulse of how our children are doing. And then the last thing that I want to mention is just looking here at some different habits that we can start to help our children to adopt that will go a long way. One is that our children oftentimes don't necessarily recognize how much the environment in which they're trying to do school or study, especially at home right now with COVID-19, can impact them. So engage your children in talking with them about what are things that not only can they do personally, or what can we as parents do, but also to think about how is the environment possibly impacting the children that we're working with. So for instance, if your child that you're working with in your organization, is in a particularly, hectic environment, or maybe it's a very loud environment, or mom and dad or, boyfriends or partners are fighting with one another, that you want to ask them, what are some things you can do when that is going on to be safe, and also to have quiet space for yourself, and to work with those children to be able to find ways to make their environment more conducive to better mental health. So overall, if you would like to find out more from some of those resources that I've highlighted, and again, those are all free resources that you can find either at wheaton.edu/HDI or on my Psychology Today blog, in which right now we're almost every day publishing new free resources there on mental health and COVID-19, with the majority of them focusing on child and adolescent related issues. Or follow me on Twitter at Dr. Jamie Aten. And there, again, you'll find more free resources on a regular basis. So thank you so much, and I look forward to hearing from the other great presenters that are up next, and to participating in the Q&A at the end of the webinar. So I'll hand it
Thank,
back over to you, Linda.
thank you so much for that great information. Now I'm going to turn the presentation over to Ariel Fox Johnson and Mr. Bill Fitzgerald.
Thank you, Linda, and thank you for having us today. That's one of the best introductions I've received, so I appreciate it. Usually as a lawyer, people aren't quite so excited to hear you speak. So Bill and I are going to talk about protecting children's privacy in a pandemic. And as Dr. Eden was saying, normal has changed a lot since the spring. Kids are spending more time than ever on screens, both for home and entertainment and connecting with family members and friends. And also kids are spending more time on screens for schooling. Distance learning is definitely the norm right now. Since the spring, we've had at least 50 million K-12 public school students learning remotely. Right now, or at least as of a couple of days ago, this might have changed. 8 states and Washington, D.C. had full or partial school closures ordered by the state. Cities have walked back reopening plans lately to open in person. Detroit stopped in-person learning. Texas, Utah, Michigan, Georgia, Indiana have all temporarily closed schools that were open. Schools planning to reopen, like Boston, have limited that. Baltimore has been scaling back. If you read the national newspapers every day, it seems we don't know if New York will have schools in person or at home. So a lot of people are learning online, and I want to first note that they're only learning online if they have the internet connectivity to do that, and that's not the focus of this panel, but I think that's important for everyone working in this space to remember. We really also need to get all kids and families and homes connected. So when everything is online, it means basically that everything is online. Your kids' classroom discussions are online, your kids' thought processes as they might work through something with a teacher. You have 5- and 6-year-olds turning in homework that has them explaining pictures that they drew of their family or their family members to a video screen. you have actual video of the family itself inside the home. And while those of us who use video conferencing for work might use virtual backgrounds or other ways to sort of protect our privacy, a lot of schools have concerns about bandwidth, and so they might advise families not to do virtual backgrounds. For kids who are going in person, they're facing privacy challenges too. Schools who are open want to try to promote safety and security and good health, and they're instituting things like temperature checks. They are having families fill out apps every day before class, sometimes about the health of the student, sometimes about the health of the family or what states the family has visited. This is more popular in colleges right now, but also K-12 schools are looking at this. They're looking at sort of smart apps and wearables to determine if you've come into close contact with someone with COVID. So this could be the app that you download on your phone, or it could be a wristband that you wear. And these can be more or less privacy protective, but in a less privacy protective space, they would track your location to a few feet and then be able to tell a school if you came into contact with someone. That could be good from a public health perspective. That could be really concerning from a privacy perspective. One school in Ohio, the New Albany School District, announced plans to look into this with its 4,800 students and to start such a program over the summer. There was lots of outrage and backlash, so they walked it back and said it was only a pilot program. So there's all kinds of sensitive health information, location information, videos from inside houses that's now in the hands of schools and service providers. And unfortunately, schools have a long history of security breaches, as I'm sure Bill could talk to you guys more about. They've always had sensitive information like social security numbers and test scores and how behavioral health issues, and they've never really had enough money to protect all of this. So the pandemic and remote learning has made schools even more attractive targets to hackers who want to hold schools up, to hackers who want to interfere and Zoom bomb, it's another new pandemic term, classes. And a recent GAO report talked about how many students had their data compromised between 2016 and 2020. And sometimes in a single breach, you could have thousands of students have their data compromised. These numbers since the pandemic are just going up and up. So now I'm going to turn us over to Bill for a second, who will start to tell us what are parents and caregivers supposed to do in this situation.
Hey Ariel, thank you for that lead in. And as everybody was talking about, there's a lot of mention of what we consider to be like a quote unquote new normal. But really, what the pandemic has done, unfortunately, is it's helped highlight things that we have just more or less been accepting as normal that aren't okay. Like they weren't okay before the pandemic, and now in the middle of the pandemic, more people are being affected by conditions that are unacceptable. So what we are calling the new normal, and for what a lot of us is the new normal, is actually what just has been quote unquote normal for communities who don't have as regular access to power as people affected during the pandemic have. With the shift to online, I think that it's easy to underestimate how profound a shift this is and how this increases our potential exposure. Ariel was talking about the increase in screen time and the implications of that. But it's also worth remembering here that not every online experience and not every piece of online infrastructure is created equally. For some people in some communities, even their internet access is exposing them to additional surveillance by their internet service provider. So one of the things to think about when we talk about privacy is what controls people have over what's shared and how they can actually understand what that means. And the best approach as we're facing this is to be skeptical and ask questions, because we should view these new changes as something that we have a right to interrogate. Like it's our lives, it's our families' lives, it's our families' information, it's our community's information. And we have an obligation to ask questions and make sure we understand the implications for us. Ariel mentioned things like temperature checks and smartphone apps and wearables. A lot of these things have no real evidence base. If we look at what we know about how COVID is transmitted, especially about how COVID is transmitted in schools, a lot of people can be shedding virus and be asymptomatic, in which case a temperature check would actually be meaningless until it was too late. Same thing with some of the apps that have been designed and marketed towards schools. These services were a lot of these services were actually built up fairly quickly and didn't have adequate quality assurance testing. And as they've been implemented in schools this fall, they've been just functionally actually less than what they should be. But also from a security place, whenever software is built quickly, that's a good environment for security issues, and that's something that again, we should all be aware of and be able to ask questions about. But the other questions that we should be asking as we're looking at this is, we need to be able to ask who's actually making the decisions here and the criteria they're using for these decisions. The third question on the slide we're looking at, who reviewed the privacy and security practices? That simple question can help highlight problems that may or may not exist within an organization's review process. And if there isn't a good answer to that question, then that's something to be aware of. And whenever you're asking about this, ask where it's written down, because that's one really clear way to understand what an organization is or isn't doing to protect the data that is entrusted to them. As we're asking these questions, other things to keep in mind is when we are interrogating the systems that we now are coming into contact with, we should do what we can to make sure that we are centering the concerns of learners and centering the concerns of the most vulnerable. This is especially true in systems that we see in higher ed, but in some K-12 as well, online proctoring systems. These systems, and feel free, if there are questions from people participating, feel free to kind of drop these in the chat. We can circle back to this. But these services take a pretty close view of what's happening within a learner's home. Like some of the more popular services require a student to do a video scan of what's going on in essentially of the room that they're sitting and working in before they take an exam. For some students, that's actually exposing other family members to surveillance, but also realistically, like it is not a normal thing and not a usual thing for somebody to have a room where they can sit unobserved in a quiet, quote unquote secure place for an hour to take an exam. And online proctoring systems definitely are tilted to give more benefit and more advantage to those with access to most resources. And this gets to the most a question that's often overlooked when we think about educational technologies. Ask what services have a peer-reviewed evidence base, because there are a lot of things that are being rolled out in schools to support learning that pose privacy issues and have potential security issues and have no peer-reviewed evidence behind them. So asking people who are making decisions about the technology that you and your kids have to interact with, ask what the evidence base is behind it. And don't be surprised when they come back with no actual evidence base, because there is not a lot of peer-reviewed evidence-based ed tech being used in schools these days.
So, as Bill was saying, it's very important to focus and center ourselves on the most vulnerable. And children and teens here are uniquely vulnerable. I think it's very important to reiterate that otherwise vulnerable populations, populations with fewer resources, English language learners, Children growing up with parents who may not be as comfortable with technology or have the time to spend on figuring out technology, they are particularly vulnerable here. So they're sort of the most vulnerable. But all children and teens are more vulnerable than adults. And they're more vulnerable because they are emotionally and cognitively different than adults. Their brains are still developing. They have a harder time understanding how online data flows work. They have a harder time understanding, terms of service and privacy policies to the extent that we think adults understand them. And they have a harder time even recognizing advertisements online. Both young kids and teens are prone to overshare. And when we're talking about them in the educational context, this is sort of doubly sensitive information because grades and teacher assessments and things like that, they can shape and alter a child's future. And this is before even getting into the, I don't know how many multiples of sensitive information that Bill was describing with needing to do video scans of your room. So historically in the US, there have been some special protections for children under 13 and also for educational information. We're waiting on those for teens, but there are starting to be some recognition that teens too are sensitive. So some overview of the laws that apply in this context. First is COPPA, the Children's Online Privacy Protection Act. And I was pleased to see the vast majority of you knew what COPPA was or answered that poll question correctly. It's from 1998, and it's designed to put parents in control of what information commercial sites and services, known as operators, collect from their children. COPPA only applies to sites and services directed to kids or to sites and services that have actual knowledge of kids. So a general audience website, like a newspaper, COPPA wouldn't apply unless there was sort of more facts there. COPPA also, COPPA requires parental consent before these sites and services and apps and connected devices can collect personal information from kids under 13. And it also requires privacy policies to give parents access and deletion rights for sites and services to minimize what data they collect and try to only collect what they need, and to put in place some reasonable security. COPPA comes from an era where one of the main concerns was strangers contacting kids, and personal information is defined as information that would allow the physical or online contacting of a child. It also comes from an era where there were concerns at the nascent but growing of commercialism from children. So it also is intended to apply to the advertising space too. Now, COPPA does apply to educational technology companies that are operating in schools, provided that they are otherwise meeting the definition. And there are some specific guidelines as to when a parent needs to give consent and when a school needs to give consent if this is an ed tech tool in a school. A school can consent if the information is being collected solely for the use and benefit of the school and not for another commercial purpose. So one question that is sort of hotly debated is, well, what if the information is being collected by this reading service or this math service because they want to improve their product or they want to improve another product? That doesn't seem like it's solely for the use and benefit of the school. That sounds pretty commercial. But it is to create another educational product or maybe to improve that same product, which would help the school. This is an open question that I just wanted to flag the FTC and Department of Education were considering back in 2017. Bill and I submitted a filing about this. We're still waiting for them to fully resolve this issue.
Can
Another law.
Can I jump in on that real? Yeah, the loophole that Ariel just highlighted, the effect of that lack of clarity shouldn't really be, it's significant because it's essentially a get out of jail free card for vendors to use data in ways that may or may not be permissible under COPPA. So the silence coming from federal regulators has been interpreted by vendors to give them broader use and broader access, which is really, again, strongly in the vendor interest, but is definitely not in student or family interest. We'll talk about this a little bit more, but just wanted to highlight that lack of clarity coming from the people whose job it is to actually enforce the law is a significant problem.
Yes, thank you, Bill. And so some other laws that also have their own problems that apply in this space are specific, like student privacy laws. So FERPA. FERPA was maybe the question that more people got wrong than other questions in Linda's poll. FERPA dates back to 1974. And in general, it ensures that parents and students have access to inspect or amend education records. It also puts some limits on who else can access a student's education record. An education record is defined as information directly related to a student, maintained by an educational agency or institution, or by a party acting for that institution. So FERPA far predates the digital world. The problem with FERPA is, while it technically says you can't share without consent, it says you can't share without consent except in all of these circumstances. And in FERPA, really, the exceptions swallow the rule. So one circumstance in where you can share without consent is the school official context. And this is what permits schools under FERPA to share information with ed tech companies and other third-party service providers. In this exception, schools can share personal information of students if they're sharing it with a third party or a vendor that's performing a function the school otherwise would, is under the, quote, direct control of the school, and is subject to some other FERPA requirements. So that's how a lot of information of students is shared with third parties. Another exception that's pretty big and is a big loophole, in my opinion, is the directory information exception. Under the directory information exception, schools have to tell a parent and give them the right to opt out at the beginning of the year. But if they do this, and it could be just a form or a posting on a website that you click through, if a parent doesn't opt out, you can share your child's directory information, names, addresses, date of birth, school activities, honors, weights for athletes, all kinds of fun information, telephone numbers. You can share it with third parties for yearbook, for drama programs and honor rolls, but also for commercial vendors or people who want to use this information in a data broker context. And again, that's sharing that can happen as long as a parent doesn't opt out. Another law applies in this context is the PPRA that mostly applies to marketing surveys. Given time, I think we'll maybe skip a bit over that. FERPA and PPRA are both enforced by the Department of Education, and importantly, they're both enforced against schools. Bill can jump in if I'm wrong, but I think that the Department of Ed has never actually cut funding for a school for violating FERPA. So that's another shortfall with the law. And then the last sort of student privacy laws I wanted to mention here are the states. Over 40 states have passed student privacy laws since 2013, trying to address the current digital reality. One of the leaders here is California, and it passed laws focused on governance. We see these vendor contract requirements, and also laws directly targeting these ed tech providers, these third-party services that are now collecting student, teacher, all kinds of fun data in schools. So PIPA is really strong. It says basically that student information should be used for educational purposes and not for commercial purposes. So you can't sell or disclose information, you can't use it to commercially profile kids, and you can't use it for targeted ads. Other states have passed other laws like SOPIPA, though often not as strong. Other states have also passed laws that address more sort of school governance issues, like creating chief privacy officer positions and things like that. All of these are generally good first steps, but they don't solve the entire problem. And I know Bill wanted to weigh in on this too, but in general, the laws fall short. Teens are not really protected under consumer laws. Kids can lie and companies can turn a blind eye. Parents may consent without thinking about it or without realizing that they're consenting. And as mentioned, particularly with FERPA, but also with COPPA, there's very limited enforcement. And Bill, I know you wanted to weigh in on this too.
Yeah, I mean, I'll weigh in a little bit later in the session, but yeah, we'll go through the various ways in which these laws have not done either what they were intended to or arguably done anything. But yeah, we can talk about that a little bit more later.
Okay. Yeah. So I mean, Common Sense was one of the groups, well, the main driving group behind SOPIPA and behind LPIPA, these student privacy laws in California. They were hailed as landmark laws by President Obama, by other folks. And now, 5, 6 years later, we're still waiting on enforcement to take place. And partly that's a function of the law, and partly that's a function of the enforcers not having sufficient resources and time and expertise. So given that there are laws, but that they don't really do everything we need them to and don't really protect kids the way we would like them to, what are steps that parents and caregivers can take? So particularly in the distance learning situation that we find ourselves in, there are a couple of key points. And we have a primer on this on the Common Sense website. If you want to check it out, commonsense.org, and then go to the for advocates, and you'll see it in our resources. Some key things. 1, make privacy a family value. Some of the stuff Dr. Aten was talking about. Talk about this stuff. Talk about it with your kids. 2, be careful what you share online about your kids and their classmates. You want to model good behavior, just how you don't always want to be looking at your phone and then tell them not to look at their phone. You don't want to post all these embarrassing photos of them and then tell them to watch what they're doing. 3, learn about parental controls so you can minimize distractions when they're in school and minimize what data collection you can. Again, this might be hard depending on school required apps, but it's something you can attempt. 4, know whether classes may be recorded or monitored. The teacher might not realize that recording a class that has a bunch of non-students in it, or even a bunch of students in it, and putting it up on a website open to everyone is a bad idea. Ask questions, figure that out, see what you can do to try to protect videos of your own student and every other student. 5, this is a common theme. And 6, learn more about what your school is doing, as Bill said, like who vetted this, what have they done with it, where can I see that in writing? Schools in many states are required to, or in general, supposed to list what apps they're using, what platforms. If you're lucky enough to have, technology experts at your school, which is a very rare thing, maybe they've vetted things, but where can you find out more information? So keep asking questions and try to sort of exercise whatever privacy options you can. Common Sense also has a number of other resources in addition to the ones in our For Advocates site. You could go to commonsensemedia.org/privacy and internet safety, and commonsensemedia.org/family media agreement. And that's where you can come up with an agreement with your family about how to use technology, including for school. In addition to school, as we mentioned, technology is ever more present in our daily life. So just also some sort of very basic tips for managing digital footprints. This is for your kids, for yourself, for anyone in your life. 1, think about who you're letting follow you and see what you do and see what you post. Limiting the audience for posts is a similar step. 3, limit activity tracking and location tracking. Now you can do these sorts of things both on your devices at the device level, like you can limit location tracking at the device level for your phone, or you can limit activity and location tracking within many apps themselves. Sometimes the phone can be more of a global setting. And Common Sense has videos on how to sort of limit activity and location tracking for specific apps and on specific devices on our website. Lastly, and I think photos are just a really important point to emphasize, and think about videos too. Think about what you're sharing and how people might feel. This is a similar point to our one about being careful about what you share about your kids and their classmates. These things really do live forever, photos and videos. And I guess in this era, we can't tell that they're any more real than text with deep fakes and things like that. But these could really make or break a kid's future depending on what it is, and no one will want to be responsible for sort of doing that in a bad or a careless way. All right, Bill, back to you.
Okay, so Ariel and I have talked a lot about the kind of various risks or things to think about, and I want to close this by talking about some concrete things that we can do to help navigate this. So the good news is that as individuals, we can do a lot to minimize the impact of technologies that erode our privacy. And the place to start is to understand what tools we have in place and what tools we don't have in place. The first thing to think about is when Ariel was talking about the privacy controls and post settings, and those are all really important things to tweak in terms of protecting yourself and your privacy from other users. But it's always good to remember that those controls don't do anything to protect your privacy from the company. The company can always see what you do, no matter what you set. So really, when we talk about privacy controls, we should really think more. We should just kind of flip that in our head to be visibility settings, because they don't actually protect our privacy from the company, but they do protect the visibility of what we do from other people. And Ariel was talking about the various, the legal landscape and existing statute. And she mentioned that there hasn't been much in the way of any enforcement action on these laws, and that's 100% accurate. FERPA came into existence in 1974. There was virtually no enforcement up until the last few years, and then I think starting 2016, 2017, the Department of Education wrote a couple sternly worded letters to people about FERPA issues. Like, for me, kind of the thing that helped highlight that FERPA really wasn't going to see meaningful enforcement action was when there was a leader of a charter school network who both published student information in a press release and then republished it in a book that this person wrote. And the penalty for that under FERPA was that staff in the school had to take a training. So we really need to understand that even though there are existing laws on the books, we're not going to get much in the way of enforcement. There's been some COPPA enforcement, but it was primarily against larger companies. Like Google had a large COPPA settlement under YouTube. But the reality is there are much smaller companies that are violating COPPA, and there isn't the time for enforcement. And at the federal level, they're really not going to go after an enforcement action unless it's like a 7 or an 8-figure settlement. And that leaves a lot of latitude for a lot of small companies to do bad things with data. One of the other things that often gets brought up is parental controls with technology. And there are some use cases where that could be valid, but one thing to consider if you are a parent or if you are working with parents is that what gets marketed as a parental control is actually another form of behavioral surveillance. And these services essentially track kids being kids, and they do it under the name of safety. But what's important to remember is that these services can also share the data they collect with law enforcement if there is a legal request for data. So just one thing to remember is, when you are, if you or someone is activating a parental control, the entity that's collecting that data has ultimate control over it. So you can be actually more protective of your kid by not using essentially monitoring software on your kid, because that exposes them to another level of risk. This also gets back to what Ariel was talking about, and what Dr. Aten was talking about. The human conversations we have with people about technology are often our most effective tools in making sure that we use it well and establishing norms around privacy. When I say to be as selective as possible at how and when you interact with technology, it can be as simple as saying, when you are working with tech around your kid, hey, I'm doing this now for this reason, and then I'm going to stop, and I'm not going to do this, and I'm not going to do this other thing for this reason. But by explaining your thought process and by explaining why you do what you do and things that you won't do with tech, you can start to frame and start to inform conversations that center privacy and center a person's right to privacy as part of what we think about in how we use tech. Because ultimately, human behaviors is human behaviors are some of the most effective way we have to protect our privacy. Small things like turning your phone off when you're not using it, or turning your computer off when you're not using it. When your phone is on and when your computer's on, it's sending data out to a variety of third parties. When it's off, it's not. That has both a privacy benefit and also an interpersonal communication benefit. When your phone is off, you're not going to be interacting with it. And this gets to the last piece. In the COVID-19 era, especially around schools, we're being told that there are a lot of silver bullet solutions to both, to online bullying in schools, to academic performance, and we hear a lot of people talking about various gaps. The most recent one I heard mentioned was something that they're calling the rigor gap, which I guess is there are some students that are being expected to do more and others that are being expected to do less. And they, of course, have a solution for it, and often that solution is technologically based. Whenever you hear somebody talking about a new deficit and pairing that conversation with a new technology, that's some alarm should start to go off at that point, and that's when your inherent skepticism should kick in, and you should start asking about an evidence base, or how they can justify it, or how well they've tested this across different types of learners in different types of contexts. Ultimately, this is a not especially satisfying answer, but our best protection against technological intrusions against our privacy are often human conversations, and those are slow and they feel imprecise, but they offer our best hope for navigating this successfully. And if you have any questions or comments that that you would like to share with Ariel and I, Ariel, I think you're on mute. So if there's any final questions or comments you'd like to add, please drop them in the chat or drop them on Twitter, and we will answer them as time permits.
Sounds great. Thank you, Bill.
Thank you, Ariel and Bill. Let's turn it over to our closer for the day, Dr. Paul Kirchen. Okay, take it away. You have control of the screen now.
Hi, everybody. Thank you for having me. My name is Dr. Kirchen. I'm just trying to turn my camera on here. One second. Oh, there we go. So very interesting lectures. I think the take-home points for me was that I'm going to schedule a family meeting now once a week. And during that family meeting, I'm going to make sure everyone's computers and laptops are off. So kind of integrating the information I learned today. So, but so as you could tell from my lengthy introduction, I have 10 jobs. Don't worry, I'm not working 85 hours a week or whatever. I just have small obligations every week at different locations. I like to be diversified in my service areas. So just to jump to, let's see here. Let's go back. So, I'm a child as well as adult psychiatrist, but I work primarily with kids in outpatient mental health settings. I see a lot of children in the emergency room, and suicide is a topic I'm often requested to discuss at lectures. And as you can see from this chart, I got this from a TED Talk actually. You can see the progress that we've made in these various diseases since 1965. You could see how many deaths we've had from leukemia and the drastic drop in that. Heart disease, AIDS. I mean, AIDS, when AIDS first came out, people thought, we're never going to get a handle on this. This is devastating. Strokes even. But if you just look at suicide, it's just been a flat line. It's truly a public health emergency, and the rates of suicide are also drastically have been increasing in teenagers. my last slide will show what's currently going on, what the pulse is on the situation on the front lines, but there is some promising data. So, you know, there's several different models for suicide. The socio-cultural model is one. So between 1999 and 2016, the CDC data from 27 states showed that more than 50% of people who died from suicide did not have an identifiable mental illness at the time of their death. One of my favorite, you know, idols that I was shocked by was Anthony Bourdain, for example. He had the life that anyone would want. He traveled and went to all these restaurants all over the world. You know, there was not much known mental illness. He did have some substance use issues, but you know, other people like Tory Burch, for example, the famous fashion icon. So you know, it's important to note that some people, you know, suicide is related to other things, not just mental illness. So often overlook societal factors such as relationship problems, grief and loss, substance abuse, health difficulties, stressors related to employment, housing, and the law are consistently correlated to suicide. That being said, mental health issues have skyrocketed 78% since 2009 to 2018. Some speculate that this is due to the trauma of insecure housing and poverty. Okay, my next slide is just only here. Give me 1 minute. Maybe if I click here. There we go. So did I okay. Let me go back. Okay, so let's go here. So what about technology's role? So while economic factors are thought to be linked to suicide and depression, this does not explain the increase in suicide during the economic recovery from 2010 to 2016. Some critics of that say, well, not everyone recovered from the economy. A lot of you know, low to middle income people still did not notice much benefits, such as the people on Wall Street, for example. But there have been some studies. In a study by Twenji at San Diego State University, 48% of teens who spent 5 or more hours per day on screen time reported at least one suicide-related outcome, versus 28% who spend less than an hour a day on their devices. So again, this is not concrete standard of care information, but as we gather more data points, we can make more of a correlation with screen time and how it affects mental illness. So it's important to realize these numbers are specific to adolescents versus adults as it relates to the developing brain, which is definitely more vulnerable than the fully formed adult brain. When I say adult brain, I'm talking 25 plus years. And there's not a lot of research into how the addiction or technology addiction could affect the developing brain. I mean, more and more research is coming out, but you know, there's definitely a difference between adults and children in their risk of getting worse depression with technology addiction. And just a quick caveat, the reason why they don't rent cars to children under 25 or young adults under 25 without a parental cosigner is because the insurance companies are smart, and they know that until you're 25, your frontal lobe hasn't fully developed. So you are much at a higher risk of impulsive behavior, car accidents, whatnot. So, you know, there's a lot of differentiation we have to make between young adults and adults, even with the developing brain and the risks and susceptibilities to addiction. So what's been the pandemic's role? Surprisingly, teen mental health during the pandemic has shown good outcomes. This was based on a teen survey comparisons by Wheaton Institute from 2018 to 2020. I believe Dr. Aten was mentioning some stats from the Wheaton Institute as well. So according to these surveys, 53% of teens said that they have become stronger and more resilient during the pandemic. Social media use and texting is down during the pandemic, but technology is being used in more purposeful ways, such as video chatting with friends. Even though boys, are notorious for gaming versus females, they're doing it in more interactive forms where they're chatting with other players while they're playing video games. So the take-home point from this survey is that not all screen time is created equal. I believe Dr. Aten was saying kids are spending more time online than ever, but as long as they're doing it in interactive ways, there's still a lot of research coming out to show that some technology is probably better than others. And I left a link here to that study that I won't get into at this time, but you could peruse that at greater length, on your free time. The other things from this study show that teens are sleeping more and spending more time with family. This seems to have correlated with possibly displacing some of that extra screen time that the kids were doing when it was just business as usual pre-pandemic. 56% of teens are saying that they're spending more time with their parents now versus prior to the pandemic. 54% said that families now ate dinner together more often. 68% of teens said that their families have become closer during the pandemic. It's nice to hear good news with all this bad news with COVID. So I actually had the intake department at Huntington Memorial Hospital create a bar, a graph for me, a pie chart basically, asking for all of the pediatric, any child that ended up on a psychiatric hold. I wanted them to kind of have a comparison pie chart. So you could see in 2018, it was 37%. That's this area in red. 2019, it went up to 38%. And you can see we're almost at the end of 2020, thank goodness. And it's dropped almost 5%, more than 10%. It's 25%. So, this is somewhat counterintuitive, but in some ways, the pandemic has been protective for teen mental health. You could even see it on the bar graph here, the drop in the numbers. Pandemic silver lining. So the take-home message: this pandemic may have been bad for the economy, but there could be something protective about it for teens. I tried to kill myself because my mom took my cell phone away. This is anecdotally still the top chief complaint for most suicidal female teens I see in the emergency room. But putting this into context is important. So, the pandemic has shown us that technology is a mixed bag, depending on whether it's used socially and whether it's used actively versus passively makes a huge difference. I can imagine not being bullied all day in a crowded classroom can be a godsend for some of these teens. And that probably has also alleviated a lot of the suicidal admissions, because I would have children that were just being relentlessly bullied in school or being beat up, or where the teachers weren't doing anything. So that could also explain a little bit why the numbers have dropped down. On the other hand, for extroverted social teens or children in domestic violence households, being stuck at home has been more depressing. So given the same information, domestic violence hotline calls are up 300%. So some of the, it might just be that some of these teens that are in this kind of domestic violence situation are not making it to the ER because the teachers are not able to observe them as closely. They're not able to see the bruises on their shoulders or in the back of their shirt or something like that. So, this survey only captures a certain demographic of our population. So it's not to say that everything is just, roses here. So with that being said, I will pass it on to the next panelist.
Well, thank you. Please join me in thanking all of the speakers for their excellent professional presentations. Folks are going to be talking about this webinar for months at the Water Cooter once offices open back up. So Nelson, do we have any questions for our guest speakers?
Yes. Thank you again to the speakers. Those were wonderful presentations. We do have some questions coming in now. Somebody's asking, what is the source for the 300% in domestic violence increase?
So can everyone hear me?
Yes.
Yeah, so that was just one hotline. I was doing a talk for White Memorial actually in Spanish, where we were doing kind of like an infomercial, and I had done some research about increases in suicide calls to hotlines. So that might just be an isolated anecdotal study that I found online, but it's been well documented because of the closure, especially earlier in the pandemic when a lot of offices were shutting down, even therapy sessions, everything is kind of moving online. And if there is someone at home who is just abusing substances, constantly abusing their partner in front of the children, it's kind of obvious. It's kind of the it's not inconceivable to see how some kids in these situations are being put at higher risk. So the partners that are being abused, there has been anecdotally increased numbers in phone calls for domestic violence at home because there's less, like the teachers are not calling DCFS, the social workers are not coming to the house because of the risks of COVID infections. So in that way, there could be a hidden problem that we haven't fully identified that because of the lockdown situation, until things get back to normal, we won't be able to appreciate things unless we look at them retrospectively.
Great, thank you. And so if any of the participants, we've got several on. If you have any questions, now is the time to submit them. Questions about privacy for your kids or issues related to mental health. We're on for a couple more minutes, so please submit them. Also, if any of the speakers have questions for each other, if there's anything you'd like to discuss or get a little bit more of, please go ahead and ask now. We have a little bit of a shy group today.
So no questions,
question for
okay.
Dr.
We have a very shy 100 and almost 200 people here.
I had a question for Dr. Aten. It's Dr. Kirkwood. So yeah, I saw that you had mentioned the Wheaton Institute. Do you do any work with them, or was that more from the research that you gathered for the talk, or?
So that was just some research that I had interviewed someone from there.
Yeah, they've been doing a lot on pandemic stuff related to teens. It's so interesting reading the surveys or whatnot. So yeah, I appreciate the synergy there on that topic.
Yeah, likewise.
Yeah.
And I really appreciated just to all the presenters, the thinking about some of those safety issues. I know for me personally, when you all were talking about how some of the safety monitoring can also be a way of actually monitoring our children or surveilling them, and hadn't thought of it in that way. So I just wanted to share that as somebody who does a lot of work in mental health and has been doing a lot of work with the pandemic. In fact, our institute, we started sharing resources a week before it was declared a pandemic. So it was something that we've been involved in since the start. But I just wanted to let everybody else know too that I had never thought of it that way. And then also hadn't thought of so many of the examples that you had just brought up on some of the positive mental health aspects. So thank you guys all for what you shared today.
I have a quick question. Can you explain a little more what a tech addiction is and what are signs of a tech addiction if we see it in our kids or grandkids?
I could talk on that a little bit. So I mean, in the DSM, in the next DSM update, they're thinking of including technology addiction. And this is kind of cutting edge research, but again, the important thing is we're still learning about this. And like the quote that I said, not all technology is the same. It really depends on the type of interaction you're having, passive versus active. I mean, if you think about it, the screen time has gone up 500% for kids. They're on the screen all day in their classes, or after they're done with school, they're FaceTiming with their friends. So it's important to realize that correlations are just that. They're just correlations. You can't make causative, it's not a one-for-one comparison. So some technology could actually be protective, especially if you're using it to socialize. Or people used to think, video games were bad, but a lot of boys now that are playing video games, they're interacting with other friends online, so that could have a protective benefit with regards to socialization. So I don't claim to be an expert in the area, but I would just say that more research is needed to make any sort of claims. But the big thing that you would find in studies is screen time. So there are some correlations with increased mental health risks with screen time, especially with my adolescent females. I see a lot of them. I've actually had a kid who came in, was suicidal, and the chief complaint was because my friend got 50 likes and I got 0 likes today. And so I felt like killing myself. So I know it sounds ridiculous for people Generation X and older, but I mean, the impact that social media has on self-esteem and impossible beauty standards, or being liked by, on Facebook or not, these things are still being studied, and we're still trying to understand how they affect children.
I do have another question for panelists now from the audience here. Some saying, I'm a third-party provider for students throughout a 7,000 square mile rural area in Montana. How can I help ensure privacy for students and their families when school staff overshare with me?
This is something that this is Bill Fitzgerald here. This is something that is pretty common within the edtech space, and a lot of this has to do with having conversations with school staff when they do that. And also, so first off, I would recommend creating some clear guidelines that you can share on your website, or via whatever means you use to communicate with clients, that say what you can and can't handle and why. This should include things like, again, you should never be getting student information in via email in a text file. Also, make sure that any staff that work for you know these guidelines as well. And then when it happens, the first time it happens, you have a choice about whether to accept the data in that form or tell them to resubmit it in a secure way, or to, again, have a more direct conversation with them. But behavior change is going to be difficult. It's going to be even more difficult now because everybody's stretched. But having some clear expectations that are written down that you can refer people to, that highlight how safe data transfers need to occur, and backing that up, reinforcing that by not accepting it when they don't, is, I think, the way to start that conversation and get some positive change going forward.
Great, thank you, Bill. Here's an interesting question about, what are the new family dynamics? Somebody's asking, what would you say to a parent whose middle schooler seems to have taken home education as a reason to take charge? He kicks her out of the living room when he's in school, hogs the family computer all the time, et cetera, et cetera. Any thoughts on that?
That sounds less like a privacy question, so I'll turn it over to the other experts.
The scenario was the child hogging the computer. Is that from the parents, or?
It's a middle schooler seems to have taken home education as a reason to take charge, kicking people out of the room, hogging up the computer, et cetera, et cetera. Any thoughts on that in terms of?
It's difficult in households where there's 3-4 kids in the house, and they have to share a bedroom with someone. Creating a private space can be difficult, and I think this would be a great solution to this. Would be something that Dr. Aten said about setting up a family meeting once a week to determine ground rules for how people are going to share the internet, or And I think as long as something like that is scheduled once a week, it could be a work in progress. It's not just like one meeting and we're done. Every week you're kind of looking forward to, how could we improve from last week with different issues that the family is having, because it's stressful for everybody to be in the household together on top of everyone's business. You could hear, if one person is doing a Zoom call in the next room, you have to put earbuds to block out the noise. I found that kind of, having earphones has been a very helpful thing, especially in crowded households where there's, if you're just on the laptop, for example, my fax is going off right now. I have to turn it off. So, you could capture all this background noise. So, just the simple logistic issues using headphones could probably limit a lot of the chaos around you. But again, this seems more like a negotiation for bandwidth. I don't know if Dr. Aten has any additional comments on that scenario.
I'll go ahead and move on to the next question. The parents I work with struggle with anxiety and tend to be very afraid of technology. How can I encourage them to have a healthy relationship with tech and privacy, specific with their children's access to tech?
I mean, just jumping in quickly here. I mean, I think the first thing I would want to do would be to understand why, like the root causes underneath why they were anxious, and understand those a little bit more, because there are some reasons to be anxious about tech use that are valid and perhaps should be considered and incorporated into whatever any solution would look like. So I think starting there, but this is also where it's very difficult to be both safe with our infection rates rising and not use technology and maintain connection with people outside. So I think identifying the behaviors that need to happen and identifying the connections that need to happen and coming up with a really targeted approach that incorporates and recognizes and sees their reticence to use tech would be a way to start. I'm sure the other panelists have more detailed things to say about that, but I would strongly encourage us not to underestimate why people have to not discount the reasons why people would be anxious about technology and understand those before we try and get them to dismiss those.
Is this Dr. Aten? I'm sorry.
Oh, that's Bill.
Oh, that was Bill. Thank you, Bill. Thank you, Bill. Linda, do we have time for another question or two, or do we need to wrap up?
We need to wrap up.
Okay. Well, if we did not get to your question, please submit it again by email, and we'll try to get it to our guest speakers and get you an answer. Thank you so much, panel, for the wonderful responses to the questions.
Thank you, Nelson. If you're interested in contributing to Consumer Action, you can contribute online by credit card or PayPal, or you can mail a check to Consumer Action Attention Membership given to our San Francisco office. So did we meet your expectations? I told you to get ready. Be prepared to be amazed. Don't forget to complete the survey before you sign off. Our last webinar for the year is on disaster preparedness and recovery. And don't forget, we're in the middle of a pandemic. So the last thing you need in California is an earthquake in the middle of COVID-19. So join us on December the 8th for that webinar. Again, I want to thank all of our guest speakers today. Please send them the heart, love, those heart symbols on the computer. I thank them so very much for their great presentations. And I thank you for joining us today. We know you're busy. Thank you for taking time out of your day. And I want to again thank our guest speakers and all of the frontline soldiers. Thank you for the work that you're doing. I sleep better at night knowing that you're out there on the front line. I look forward to welcome you back on December the 8th. Until then, stay safe and stay sane if that is at all possible. Thank you again, all our guest speakers. Thanks again. See you on December the 8th. I'm signing off now. Goodbye.
Bye.